Hello, I'm Sarah, and I'm a board-certified behavior analyst. I make videos about applied behavior analysis, or ABA. ABA is most commonly used for and known for teaching skills to people with autism, and also decreasing and replacing challenging behavior. Some would claim that ABA is controversial in the world of autism treatment. It's not hard to find vehement opposition toward it on platforms like Twitter and TikTok. I'm here to explain why that is and to set the record straight. Don't forget to like this video and subscribe to my channel. Now let's get started. Prior to the emergence of ABA as a treatment for autism, the severe behaviors and social challenges associated with autism were often treated using methods such as shock therapy or even giving the person with autism doses of LSD. Very commonly, people with autism were institutionalized when their caregivers felt like there was nothing they could do to keep them safe or to normalize them. ABA first emerged in autism treatment in the 80s when Ivar Lovaas developed a groundbreaking intensive behavior therapy for children with autism. He, like today's behavior analyst, relied heavily on positive reinforcement to decrease challenging behavior and teach new skills such as communication, but he also used methods that, while well-intended, are now considered overly restrictive by today's standards. Such methods included using aversive stimuli and requiring the learner to endure repetitive learning trials, even when the learner was visibly upset and not willing to participate. Arguably, this was an improvement compared to the use of institutionalization and electric shock, but still did not meet the ethical standards of the modern-day BCBA. Some people who received ABA treatment in the decades that followed its emergence have communicated that they experienced trauma as a result of being physically coerced to participate in learning trials, being ignored when upset during therapy, being forced to make eye contact when this was painful or overwhelming, being forced to act like something they're not, becoming dependent on extrinsic motivators, and being forced to suppress self-stimulatory behavior or stimming, which many feel is necessary for people with autism to regulate their sensory systems, or to just feel relaxed and happy. The people in our field take none of this lightly. As a field, we've heard the stories of people who have received ABA treatment in the past and have taken major strides toward making our therapy actually therapeutic, driven by truly positive and responsibly managed reinforcement and by client assent and dignity. While most behavior analysts and therapists out there want nothing but the best for their clients, there are still some out there who might use methods that are coercive or overly restrictive. But the fact remains that ABA, when done well, helps people tremendously. I've seen so many children with autism learn to communicate, learn how to be safe, become more independent, and make authentic connections with other people because of it. It's backed by tons of peer-reviewed research, and it even extends beyond the world of autism to make life better for all kinds of people. In addition, we're required to follow the BACB Code of Ethics in our practice, which requires the very best treatment for our clients. I'll leave a link to it in the description. Also, you can learn more about how amazing ABA can be in my overview of ABA video. I'll leave a link in the description to that as well. Anyway, ABA clients and their caregivers should know what to look for and what to avoid when shopping around for ABA programs. So here are my recommendations. Ask the BCBA in charge of the program what their perspective is on stimming if your learner stims. An ethical BCBA might recommend decreasing stimming if it's dangerous or if it severely impacts the learner's ability to participate in settings, activities, and social interactions that they enjoy or that benefit them. But getting rid of stimming just because it's unusual is a huge red flag. Also, you should know that a BCBA or ABA therapist is required to receive client or caregiver consent prior to attempting to reduce any kind of behavior, and the client or caregiver can withdraw consent at any time for any procedures that they don't feel comfortable with. Next, ask the BCBA their perspective on escape extinction, which is the ABA term for making a learner do something that they don't want to do, even if they engage in challenging behavior to attempt to get out of it. Just like with stimming, an ethical BCBA might use escape extinction if it would be harmful for the learner to get out of doing something. Examples would include going to bed at night, brushing their teeth, or holding a trusted adult's hand while crossing the street. But forcing a learner to do something that they really don't want to do without good reason is ethically questionable. Instead, an ethical BCBA will look for ways to motivate the learner using positive reinforcement instead. After that, ask the BCBA their perspective on attention extinction. This just means ignoring a behavior that serves the function of attention. If a challenging behavior is confirmed to serve the function of attention using a functional behavior assessment, an ethical BCBA will teach the learner an appropriate way to get the attention they seek, and then they might also withhold attention for the challenging behavior. But if the BCBA ignores the learner when the learner is engaging in a challenging behavior regardless of why the behavior is happening, this could be potentially traumatic for the learner, and you should ask them why they're doing this. Just in general, when a BCBA recommends reducing a challenging behavior, ask them what appropriate and functionally equivalent replacement behavior they're going to teach the learner to use to communicate their needs instead. Ethical BCBAs should be prepared for this question. Next, ask about physical prompting. Does the BCBA recommend physically forcing the learner to do things against their will? Obviously, that's a red flag, so steer clear of that. Physical prompting, often as hand-over-hand prompting, can be used to teach the learner new skills if they let you know that this is okay to do. Next, ask the BCBA their philosophy on teaching eye contact. Eye contact could be considered an arbitrary social goal, and if a BCBA tries to force eye contact when the learner isn't comfortable with it, or uses physical prompts like moving the learner's head or neck, or blocking their peripheral vision like this to teach it, you should know that this is not something you have to agree to. Next, when your BCBA recommends a reinforcement system, ask them how they plan to fade it out over time so that the learner isn't dependent on a system that's cumbersome or unrealistic after services are faded or discontinued. For example, if M&Ms are being used as a positive reinforcer in an ABA program, ask them how they plan to make intermittent social reinforcement like praise the long-term reinforcer in the natural environment. Next, ask your BCBA how the learning environment is set up and how therapy sessions are structured. Make sure that it would be appropriate and fun for your learner, and that it wouldn't be overly restrictive or unrealistic for your learner's age and ability. For example, no 2-year-old should be expected to sit at a table and work on picture matching for 30 minutes straight. Instead, learning should happen during play for someone this young. If the ABA program takes place in a setting that you can't usually access, like a clinic, ask to observe your learner's sessions from time to time. This will ensure that the program is being carried out according to your priorities and values. My last bit of advice is to ask to see the graphs. ABA is nothing if not data-driven, and the BCBA should have data collection systems in place to track your learner's progress toward their goals. Ask not only to see the graphs, but also for the BCBA to explain them to you. If the challenging behavior data aren't going down, or if skill acquisition data aren't going up, ask why and how the BCBA plans to address this. And that's my summary of how you can evaluate the ethical quality of an ABA therapy program. Again, ABA therapy can change lives in amazing ways when implemented by professionals who practice within their scope of competence and who use compassionate, client-centered methods. Please leave your questions and comments down below. Let's have a conversation and work together to make the world a better place for people with autism. Thank you for watching, and I'll see you in the next one.